Hello there and welcome back to Elite Healers Massage Therapy on YouTube with Adam Cardona. I appreciate you tuning into this episode. In today's episode, we're going to be talking about the massage and stretching that you need for the proper self-care of the muscles of your torso, which include the back. I realize this is probably one episode a lot of you are waiting for, since I know many adults suffer from some form of back pain at some point in their lives. The back is an area of a lot of muscles, and as I teach you these techniques, I'm also going to talk about the muscles in that area so you understand them a little bit better. One of the greatest values of this video is it's really good for maintaining your muscles between massage therapy treatment sessions. Doing the self-massage and stretching techniques between the sessions is going to help you move better and live a life in less pain. Because let's face the facts, you're not designed to effectively care for your back muscles without a little bit of help. The main reason that you'll need professional help every so often is what I just said. So if you're in the New York City area and you need massage for your back or anywhere else that's hard to reach or not, then schedule with myself or the team at www.elitehealersmassagetherapy.com/appointment to schedule your massage therapy treatment session. Also, you should know that I won't be talking about glute muscles in this episode. Make sure that you instead watch the video on self-care of your muscles for your pelvis if you want to learn how to take care of your glutes or anything that's a little bit lower than the torso. Also, if you think I missed the self-massage technique, then I want you to go back and either watch the 3 techniques for lower back pain self video or the shoulder self-massage video, because that's going to probably cover what you think I'm missing in this video. Right now, I'm going to have pop up the Specific Self-Care playlist. That way you can just click on the video, since they can be both found on that playlist. Soon, there's going to be premium content that's going to create a greater library of on-demand self-care videos, so stay tuned for that if you want more coaching. I'll be making it cheap and affordable, so anybody who wants premium content can get it, because it's going to be at a low price, especially at first. And finally, before we start off, make sure that you just firmly press down on that like button to show me that you're enjoying this video that I am making for you. Alright, so today let's start off by learning a self-massage technique for your mid-back muscles that are located between your shoulder blades. These are what's known as the rhomboid muscles. The rhomboid muscles, they attach to the thoracic bones of the spine, and then they basically go out and attach on the shoulder blades. And one of the things they do is help pull those shoulder blades back, like when you're doing a row at the gym. They work opposite the pectoralis major. So, if the rhomboids become weak, that can result in forward shoulder posture and create an imbalance. So, one of the things is some of you will have to strengthen rather than stretch the muscle, but giving a little bit of a massage, self-myofascial release, is a great thing just to help the muscle function a little bit better. It's great for if you sit at an office, at a computer all day, or driving. You want to make sure that you can have those muscles properly mobile so you can strengthen them and make the posture better. So one of the things you have to do for the rhomboid massage is you can have to make sure you have the right tools. One of the things you're going to need is a pair of therapy balls that are either attached or therapy balls that come together in a sleeve that you can pull tight and it's safe. I say that you could put 2 tennis balls in a sock. That's a little more risky, and I don't want you hurting yourself, because one of the things is you got to be safe on this channel. That's a baseline right there. So make sure if you don't have the tools, you go to the link in the description and you order the right tools so you can do this. Now, one of the things is you have to make sure that you have the 2 balls so it has a gap in the middle, because you do not want to put pressure on the bones of your spinal column. That could hurt yourself, and the worst type of injury that you can have from putting too much pressure on the spine is you could paralyze yourself. And on the lesser parts, you can just have some kind of nerve damage. So please, make sure you have the right tools if you're going to do this particular technique. Now to start, let's take our towel and place it down about where we're going to put our upper back on. The towel is really meant to prevent any slipping from your body off the therapy ball. You don't want to do that. You can hurt your back. Now, what you're going to do is put the ball right in the center of that, and with either your own guidance or the help of a partner, you'll slowly position yourself so the ball is between the shoulder blades and it avoids touching the spine. You can just put a little bit of pressure to see if you're on it, and if you are and not on the bone, then you can sink into it. You can do this, you can hold and you can breathe. You can think about opening up your chest to really contract those muscles on to the area that you're compressing. And if you want a more active, like a stretch and contract movement, just to kind of break up the tissue, get your shoulder blades away from you by reaching out in front of you and bringing it back. The arms just like that. Ooh, I can feel it myself. Breathe as you do this, active breaths. This is more of a warm-up activity. Then when you're done, put your arms and your hands to the side. Slowly come up off of it. And then you'll have done a little bit of self-massage to your rhomboid muscles. So now let's start by talking about stretches for the torso. We start by taking a moment to go over a lesser known muscle in your back, which is known as the Quadratus Lumborum, aka the QL muscle. First, in terms of where it's located, it's deep in the body, deep to the latissimus dorsi muscle and your lower back fascia known as thoracolumbar aponeurosis, and it's just superficial to your kidneys. What this essentially means is that you should be very careful about any form of massage, self-massage to this deep postural muscle. For the average person who is untrained, self-massage to this QL poses more harm than benefit, so that's the reason I will not be teaching you this technique in this episode. Having a professional massage therapist work on it is a safe bet. If you're in New York City, then you know what to do. Schedule your appointment at www.elitehealersmassagetherapy.com/appointment to schedule myself or a different therapist that can help you take care of those harder to reach muscles. Make sure you get the professionals to take care of it. You know what I'm saying. Now, what this QL does is it helps extend your lower back, so it helps keep your back straight, and also it does a little bit of lateral flexing, aka side bending. When the QL gets tight, it gets tight from extending your back for long periods of time. What we'll do with this stretch is that we're going to go over it and we're going to review it in a way that really helps isolate the muscle. Anyway, let's get ready to stretch the QL in a move that I call the QL modified child pose stretch. We'll start the stretch by kneeling on a soft surface, and then what we're going to do is make sure that we sit back on our heels. This will result in having your body in a nice straight posture. And then what we're going to do is we're going to reach off to one side with the arms just on the ground. So just like this. We'll hold, we'll breathe. And you just do it in a nice pose. Reach off to one side like a child's pose. Right now I'm doing it off to my left. Then you come out of it and you go off to the other side. You reach down, you hold, you breathe. Now I reach to my right and my left is getting stretched out. Then hold 30 to 40 seconds, come out of it, and you'll have stretched your QL on both sides.